Cave-of-Eric's feet are a specific condition that affects both children and adults. Ultimately, it describes the shape of the foot at its first presentation. If you are looking from a side of the foot, as most people will have and will be aware of, there is a small arch that is present, and that is normal. In a Cave-of-Eric's foot, that arch is significantly increased because of the abnormal muscle pull that goes across the foot and the imbalance that occurs between muscles that are outside of the foot and the muscles that are within the feet. This then subsequently leads to an abnormality of the heel. The heel itself normally tends to be slightly outward facing when looking from behind, but in a varus deformity, the heel is then inward facing. This ultimately leads to a significant imbalance of weight when people are walking and to subsequent pain. The pain itself may well be the first presentation, but the key in the pediatric population is that the foot deformity may be the first sign of an abnormality within the child in general. And that's because of the fact that the Cave-of-Eric's foot may be the first presentation of a neurological disorder. And in over 50% of children, there are neurological conditions associated with Cave-of-Eric's feet. Because of this, part of the investigation involves genetic analysis for children. This genetic analysis is looking for specifically a condition called Charcot-Marie-Tooth disease, which is partially hereditary, and there may be a history within the family of foot abnormalities and foot deformities. Treatment of the foot deformity is primarily led by managing someone's symptoms. Having initially confirmed a diagnosis, the key is then to work out how is the foot affecting a child's life, what is it stopping a child from doing, and whether ultimately even an intervention is even required. The mainstay of treatment, certainly at the early stages, is to try and provide support for the foot itself, so that when the child is walking and weight bearing or running, they aren't having significant pain. And this is by using orthotics that are custom made to fit the child's foot. Depending on how the deformity progresses, and depending on the wishes of the family and the patient, it may be that further support is required around the foot itself, and that can be in the form of shoe wear that can go above the ankle to stop recurrent sprains, or it can be to slightly bigger orthotics, which may include a support that goes up above the heel. However, because of the nature of the deformity is often progressive, pain can get worse because of the overloading of the foot. And as a result of that, surgery may often be indicated. And there are a number of different surgical options available depending on whether the deformity overall is what we term flexible, which is whereby when we look at the foot and we put the foot with the child weight bearing on examination, surgical options for a child are dependent on the overall clinical examination. The clinical examination will tell us whether the foot is flexible or whether the foot is fixed. And that is extremely important because if there is evidence of flexibility, it suggests that we can carry out a soft tissue rebalancing of the foot by either transferring tendons or lengthening tendons with an associated bony surgery, but that is relatively minimally invasive. If a foot deformity itself is fixed, it suggests that no matter what you do to the tendons or the muscles around the foot, the deformity won't change, and ultimately the child's symptoms will continue. And in this instance, there are a number of different options. For example, you can focus primarily on an individual bone to try and change the shape of the bones, and that will change the overall shape of the foot as a whole. Or you can carry out what we term frame correction deformity, or what we term as frame deformity correction, which is something that I carry out and primarily involves ultimately placing a large metal cage around the foot to gradually change the shape of the foot, slowly but surely into appropriate position. The advantage I feel with this particular form of treatment is that it does not affect, or we avoid specifically the joints themselves. So we try and maintain the flexibility of the foot as much as possible. And in addition, children who have this Caber-Barres foot condition often particularly have small feet due to the nature of the muscle imbalance that occurs. And as a result of that, trying to carry out significant bony surgery on a small foot can often make a foot smaller, and this will affect the child, particularly in adult life. And this is where a frame may be advantageous because it actually increases the size of the child's foot.